Hi, thanks again for joining White Coat Medicine Talks, and today we'll be talking about a different topic. Remember, you can always go to the playlist on this channel and see what different topics we are covering, and we will try to update those as soon as possible. Now, today we're going to cover colon cancer. Now, why colon cancer? Well, it's when you combine both men and women, it's the third most leading cause of cancer that is found, and it's the second leading cause of cancer death. So that's enough reason. But sometimes the symptoms that you get when you're going to get colon cancer are maybe a little too late. And so we can try to do something to prevent this. And the most important thing is that this cancer is preventable if you take the right steps. So when do we start screening for colon cancer? It used to be 50 years of age, but they discovered that if they decrease the age to 45, we will catch many more cancers and prevent many more cancers. So they dropped it down to 45 years of age, and we screen all the way up to 75 years of age. After 75, it really depends on the health of the person, and once you discuss it with your doctor, you can determine whether there is a necessity at that time to do colonoscopies and continue to do screenings as well. So usually colonoscopies are done every 10 years. However, there are some exceptions to that. If you do have a family history of colon cancer, you're going to do it 10 years before they found that cancer on that person in your family. So if they found it at age 40, then you're going to start doing your colonoscopies at age 30. So that would be one exception. There's also a family history of polyps that can occur. And if there is a family history of polyps, which is sometimes a genetic problem, then you're going to be doing these colonoscopies a lot sooner as well. And if you have anything like Crohn's disease or ulcerative colitis, those type of disorders, you will also be doing colonoscopies before 45 years of age as well. The exam itself is not difficult. They usually put you to sleep. They will do the colonoscopy at that time, which they will have a camera that will go through the rectum and look at all the large intestine. Now, if there's any polyps in there, they will go on ahead and take those out and check them. If those are adenomas, which would be the precancerous type of polyps, then you're probably going to have colonoscopies done sooner than 10 years. Maybe every 3 years, every 5 years, or if you have a lot of polyps, maybe even yearly for some time until they make sure that there is no more polyps there. There are other studies that can be done to visualize the intestine, such as a CT colonography, which would be done every 5 years, or a flexible sigmoidoscopy, which would also be done every 5 years. I personally recommend the colonoscopy because at that point you can visualize the whole large intestine and do the biopsies necessary to make sure that there's no polyps left behind. When your doctor doesn't do a test to visualize the colon, then they will do a stool study test. Now those are good for different amounts of time. Some tests are good for 1 year, some tests are good up for 3 years. But it's very important to get some tests done to make sure that we can kind of rule out the possibility of there being colon cancer. So as you can see, the screening is rather easy to do for colon cancer. Please ask your doctor about colon cancer and the different screenings and what test is appropriate for you. Now, for White Coat Medicine Talks, this is Dr. David Cruz, and we'll see you next time.